If you come into the hospital, you'll notice it's clean, it's pleasant, and we encourage people to help us in preventing infection risk to our patients. So you'll see, for example, the need to wash your hands the minute you enter the building.
The first important factor in controlling all hospital-acquired infections is to try and focus on all of them, not just MRSA. The best way of doing that is by focusing on the basic principles for prevention of infection. Hand hygiene, for example, hand washing with soap and water, using alcohol gel. Looking at the environment around the patients, making sure it is clear and clean and there are no little pockets where these infections can hide. There is also another important part to fighting hospital-acquired infections, which is using antibiotics wisely. They are very precious, and we're finding increasing that the resistance to antibiotics is developing all the time in different types of organisms. So we really have to try and use antibiotics wisely. I mean, obviously in the Matron's Charter, infection prevention and control is a key thing now. And our modern matrons here, we talk to them all the time. We have got the day-to-day link with them, especially around infection incidents and outbreaks.
Infection control, we've just had a trust-wide launch to make our band 6s on the wards, which are junior sister levels, and the infection control link nurses, the key people on the ward with the responsibilities for infection control and making sure infection control policies are adhered to by all the staff. Families have a very big part, and relatives and carers, to help us with infection control. Obviously at every entrance to the trust and every exit there is the stations with the alcohol gel and hand rubs on them, so we'd encourage the families to use that every time they come in and leave the buildings.
We are really leading in amongst the specialist hospitals when it comes to hospital-acquired infections, and our rates have been very good.